Hi, this is Nicole Corpy-Steiner, a member of SYCL and the SYCL Committee. I am thrilled to welcome you back to SYCL360, which is SYCL's online news resource that aims to keep you up to date on topics likely of interest to SYCL members. We have a very exciting lineup for you in this edition. To start us off, Dr. Kaylin Olson will be discussing the do's and don'ts of successful abstract writing with tips provided by Dr. Thomas Ansley and SYCL members. As the AACC abstract deadline is quickly approaching and many of us have yet to begin writing, take a moment to check it out. You may find tips that will help enhance your abstract. Next, hear insight about the new Biomarkers of Cardiovascular Diseases Division in an interview with Dr. Alan Wu, conducted by Dr. Deborah French. Dr. Wu is the chair of this new division and world-renowned expert in the field. In this interview, he discusses how the division transpired, the direction the division is headed in, and how you as SYCL members can get involved. So don't miss out on this great interview. Another exciting interview occurred between Dr. Mark Kellogg and Dr. Joe El-Khoury. During this interview, Dr. Kellogg, an active member of AACC and past chair of the Northeast Local Section, describes value of local section activities, as well as why it is important for SYCL members to get involved in their local sections, including some of the many opportunities and benefits available. During the interview, Dr. Kellogg says, "The next step is yours. So make sure to check out the interview and your local section too." Lastly, haven't you been wondering what the correct answer is for the latest FunFact question? The question sent to SYCL members was, what are the 4 most viewed tests on Lab Tests Online? Well, the answer may just surprise you. Find out which tests are most viewed on Lab Tests Online, as well as see SYCL members' cumulative responses to this question. Additionally, opportunities available to you through Lab Tests Online are highlighted, so make sure to check it out. We hope that you continue to enjoy SYCL360, your SYCL news resource, and we would be thrilled to receive your feedback and thoughts about SYCL360, as well as ideas that you may have for SYCL news topics to include in future podcasts. So please send us an email. We look forward to hearing from you.
As the abstract deadline for the 2013 AACC annual meeting is fast approaching, this is a good opportunity to discuss the do's and don'ts of writing a successful meeting abstract, including advice from SYCL members and expert Dr. Thomas Ansley. Before we get started, here are a few reminders about the annual meeting. There are many awards available to SYCL members, including travel awards and abstract awards. I encourage you to review the February 2012 SYCL360 podcast or the list on the SYCL website for more information. The abstract submission deadline is February 27th at 6 p.m. Eastern, and you can find the submission instructions on the AACC annual meeting website. Lastly, remember to register for the 2013 SYCL Workshop in Mixer. This year's workshop will cover some great practical tools that will help you be successful as a lab leader. Details about the program will be coming soon. In order to help new abstract writers or veterans who need to brush up on their skills, we asked Dr. Thomas Ansley, an active AACC member and past SYCL Mentor of the Month, to share his expert insight on successful abstract writing. Remember that an abstract is just that, not a full paper. The abstract should be brief but informative so that readers can understand the importance of the research, and it should be presented in a manner that stimulates interest such that the readers will seek more information by visiting your poster at the meeting. Dr. Ansley's tips for basic elements of an abstract are summarized on this slide. Whether you are writing an abstract as part of a journal paper or for a meeting, it is important to always follow the stated requirements like word count and format. Dr. Ansley has offered some helpful do's and don'ts for successful abstract writing in the next 2 slides. Some of these words of wisdom for the do's include using the active voice and answering the initial study question. Focusing on these do's will help you write a clear and organized abstract that is reader-friendly for those who may be less familiar with your research topic. Some of the don'ts for abstract writing include avoiding abbreviations and weak phrases. Additionally, the abstract should clearly state what the data indicate and summarize the great work you have accomplished, rather than focusing on your next steps. The visibility that an abstract and poster provide is especially great for young investigators. Presenting your work at conferences like the AACC annual meeting can provide a forum for meeting potential collaborators and receiving constructive feedback for future endeavors. The abstracts from the AACC annual meeting are published in the Clinical Chemistry Journal so that you can take pride in your hard work and a well-written abstract for years to come. Another great source of helpful advice is your fellow SYCL colleagues who have had their abstracts recognized by SYCL or the NACB at previous annual meetings. Amy Pyle recommends your abstract be concise and to the point, and she reminds us that a meeting abstract is a great forum for your smaller studies that may otherwise go unpublished. Leslie Donato adds that the clinical utility of the study should be emphasized, and she provides some great examples. Show how you are helping improve laboratory medicine and patient care, and people will be more likely to seek out your poster. Finally, Dina Green recommends picking out a project that inspires you so that you can inspire excitement about your research in others. When people can feel that you care about your research, they're more likely to care too. If I can add one last piece of advice, I would encourage you to ask colleagues to review your abstract and provide comments and suggestions. It often helps to have a fresh eye after you've looked over your own writing for so long. Good luck, and see you in Houston.
Today we would like to take some time to help familiarise SYCL members with AACC's specialised scientific divisions. Did you know that there are 16 AACC scientific divisions currently available? These divisions are specialised interest groups within AACC that provide education, service and networking opportunities for any and all interested AACC members that choose to join, which could be you. Each of the divisions is unique, but they all further AACC's vision by advancing the practice and profession of clinical laboratory science and its application to healthcare. In 2012, AACC members and key leaders in the field collaborated and worked together to develop and implement two new successful divisions, including the Personalised Medicine Division and the Biomarkers of Acute Cardiovascular Diseases Division. If you are not a member of a scientific division yet, or you are looking to expand your membership, we highly encourage you to view the objectives of the divisions on the AACC website. Links to the objectives for the two new scientific divisions are shown here, and if you are interested, you should take this opportunity to join and get involved. Today we have the exciting opportunity to learn more about the Biomarkers of Acute Cardiovascular Diseases Division, with behind-the-scenes insight from Dr. Alan Wu, a key leader in this field of study and a person that played an invaluable role in the development of this new division. Now I would like to introduce Dr. Alan Wu, the Division Chair of the Biomarkers of Acute Cardiovascular Diseases Division. Dr. Wu, thank you for joining us today.
Well, thank you, Deb, for having me today.
So can you tell the SYCL members what prompted you to start this new division?
Well, my interest in cardiac biomarkers started when I was a fellow over some 30 years ago at Hartford Hospital. At that time, we were pretty much talking only about CK&B. There probably wasn't enough interest to start a division back then. But since that time, there have been many more biomarkers of acute cardiovascular disease that are now in routine use in clinical practice. I'm talking about troponins, the natriuretic peptides. Some of you are still doing myoglobin. C-reactive protein continues to be very important. And there are still many other biomarkers in clinical research and trials, such as galectin-3, ST2, fatty acid binding protein, myeloperoxidase, copeptin, just to name a few. There are many issues surrounding cardiac biomarkers, such as assay standardization, further biochemical characterization, the development of clinical practice guidelines from a marker standpoint. So a few of us old-timers, including Rob Christensen and Fred Apple, decided to form an AACC division so that some of these issues can be tackled in a systematic way by interested members.
Great, so what are the plans for this new division?
Well, while the original intent of this division was cardiac biomarkers, which has been the major focus for most of the last several years, it became clear to us that there is a need to expand to other cardiac disease areas where emerging markers have or are being developed. So we are seeking participation into various emerging cardiovascular disease areas, such as stroke, venous thrombosis, peripheral vascular disease. It may also be appropriate to consider other diseases that are not necessarily cardiovascular in nature, where there is a need for acute biomarkers such as sepsis, and the big one that we hear a lot now is traumatic brain injury.
Great. So how can SYCL members get involved in this new division?
So one of the major objectives of this division is to get younger AACC members involved with the clinical science of chemistry. You know, Rob, Fred, and I, and many others in the leadership division will probably retire in 5 to 10 years. And quite frankly, we're looking to pass the torch to younger AACC members, and we look directly towards SYCL to help us achieve these goals. We are particularly interested in individuals who are directing efforts in the emerging areas of heart disease, such as that which I've mentioned. We anticipate that this could be in combination with senior AACC members, SYCL members, and our interested colleagues from the in vitro diagnostics industry. One way to get involved is to see what research or clinical trials that are being done at your institution today, and try to get involved with those trials by contacting the principal investigators at your institution. You'll find, as I have over the years, that they will very much welcome the expertise of the clinical laboratory in conducting their trials. At that point in time, you can then start getting into the field.
Well, I'd just like to thank you so much for this invaluable insight that you've given us into the new Biomarkers of Acute Cardiovascular Diseases Division.
Well, you're very welcome, and I might just mention that we are planning a division symposium this year on the Saturday before the AACC annual meeting in July in Houston. More on that later.
ListServs are collaborative email lists that enable subscribers to exchange ideas and discuss issues via email. In order to join the ListServ for this or any of the AACC divisions, go to the AACC website, click on the Resource Centers tab, and then on the left-hand side click on ListServs, and then you can select the ListServs that you are interested in joining. Another way for SYCL members to get involved with this division is to apply for an Outstanding Research Award. This can be done by checking the appropriate box on the award/grant section of the AACC annual meeting abstract submission form and submitting an abstract in the field of acute biomarkers of cardiovascular disease. In order to qualify for this award, you must be the presenting author of the abstract must be accepted for a poster presentation, you must present the poster at the AACC annual meeting, and you must be a member of the Acute Biomarkers of Cardiovascular Disease Division. And just as a reminder, the abstract deadline for the 2013 AACC annual meeting is fast approaching. It is Wednesday, February 27th at 6 p.m. Eastern Standard Time.
Hi, are you aware of the educational, networking, and service opportunities available to you through your local AACC sections? There are over 20 local AAC sections spread out over North America, with 5,373 members currently in these sections. Please take a moment to locate a section in your area. With me today is Dr. Mark Kellogg, an active member in the Northeast Local AACC section and currently serving on the board as past chair. Today, we are excited to hear his insight regarding the value of these sections and potential benefits available to SYCL members by being actively involved in local sections. Hi Mark, thanks for joining us today.
Well, thank you for inviting me, Joe. I'm happy to speak about the important role of local sections.
Thank you. So, from your experience with the Northeast section, what role do the AACC local sections play?
Local sections play multiple roles, but I find that the networking opportunities are the most important role that local meetings and events play. This networking provides opportunities for members to volunteer or to be invited to volunteer and to learn some of the politics that go into being involved in the AACC organization. involvement in the local section is a simpler and easier way to manage learning those politics than jumping straight into the national level committees and activities.
So, can you please describe some of these activities that these sections routinely conduct?
Most local sections have a regular scientific meeting where a presentation is made on a topic of interest to clinical chemists. In the Northeast, we try to rotate topics between something from an IVD or biotech company in the emerging technologies area to something that's more clinical lab-specific, clinical trials. Most sections also will have a social gathering prior to that presentation, and as I discussed before, the networking opportunities are probably the most important function, and so attending that social gathering is important, a great place to network. A good section will have officers floating through the crowd, making sure conversations are started, but it's important for new members to seek out the leadership and introduce themselves. Some sections will have other outside activities like science, technology, engineering, support, or other community service type activities.
So, why do you feel it is important for SYCL members to be involved in these activities and to contribute to these sections?
A local section in the national AACC is only as good as the people who volunteer and get involved. Unfortunately, in many organizations, the majority do not volunteer as they see this as too time-consuming. In many cases, they may be correct, but if more people volunteered, then the workload would be reduced for everyone. SYCL members in particular should get involved because they will be forming that network of colleagues that can assist them in their professional development and assist with clinical issues in their own geographic area. Knowing the clinical chemists and laboratory professionals in your area is probably the most important network to develop. It's also a great place to find mentors who can assist you with your AACC career development and professional development through recommendations and invitations to participate in other activities. While knowledge is important, I firmly believe that career development relies more on who you know more than what you know.
I could not agree more. So lastly, how can we become members of the AACC local sections?
Well, everyone who is an AACC member is automatically a member of their local section based on their geographic assignments. For example, an AACC member in Maine, New Hampshire, Vermont, Massachusetts, or Rhode Island belongs to the Northeast section. A resident of New Jersey belongs to the New Jersey section. You should receive an email or a mailer from the local section. The national office provides each section a list of their members. But once you get that invitation, the next step is yours. You need to show up and introduce yourself. If you haven't received info from your local section, check out the local sections page on the AACC website for the event listings and contact info. Don't be bashful, reach out to them if they haven't reached out to you.
Great. And as a member of the Northeast Ohio section myself, I also strongly encourage all SYCL members to look up and join their local sections to benefit from these great opportunities. Dr. Mark Kellogg, thank you for your time and your valuable insight.
You're welcome.
Hi, welcome back to the SYCL360 FunFact series, where we attempt to challenge you with trivia randomly related to laboratory medicine and post your cumulative responses for all to view here on SYCL360. In this edition of the SYCL360 FunFact series, SYCL members were asked a question focusing on lab tests online utilization. Thus, we would like to take a brief moment to first better familiarize you with lab tests online, an invaluable resource and extraordinarily successful AACC initiative. Lab Tests Online is a non-commercial, peer-reviewed patient resource on medical laboratory testing that provides a plethora of free information to millions of patients, caregivers, and medical professionals from around the world. The insightful content ranges from hundreds of tests, conditions, and screening recommendations to putting a test into practice, commercial testing and FDA approval, laboratory-developed tests, clinical trials, and much, much more. Altogether, successfully supporting its aspiring mission to improve health literacy by providing clear, accurate, and accessible laboratory information. Today, Lab Tests Online is recognized as one of the premier healthcare information resources on the Internet and a global standard for patient education, and was honored in 2012, receiving a highly respected Communicator Award, which is sanctioned and judged by the International Academy of the Visual Arts, and further named one of the 100 best nursing websites by a nursing community comprised of RNs, LPNs, student nurses, and medical support staff on nursingbyNurses.com. It is clear that Lab Tests Online is a highly utilized resource. Thus, in this edition of the SYCL360 FunFact series, we asked SYCL members, what 4 tests were most viewed on Lab Tests Online, noting that the views were limited to the Test tab only during the period of October 1st, 2011 to September 30th, 2012, and the 4 possible multiple choice answers are shown below. Here are the survey results indicating SYCL members' cumulative responses. The majority of responders chose answer B, including prothrombin time, glucose, erythrocyte sedimentation rate, and creatinine. This was closely followed by answer A. Well, the correct answer is actually option A, including tests CBC, TSH, ANA, and BUN as the top 4 most viewed tests on Lab Tests Online during this period. So congratulations to everyone that chose option A. This was a playfully challenging question, however, as any of the multiple choice options are a good answer, with these 16 tests comprising the top 16 most viewed tests on Lab Tests Online during this 1-year time frame. All of these tests have been viewed more than 300,000 times throughout several with more than 500,000 views, with CBC leading the way with over 1,400,000 views during this 1-year time period. So if you have yet to check out these tests on Lab Tests Online, I highly encourage you to do so today and see what all the excitement's about. The Lab Tests Online site itself was visited by more than 27 million interested viewers during this period, further supporting Lab Tests Online as a premier online healthcare information resource. It is important to note that these data were confined to the U.S. version of Lab Tests Online only, though versions of the Lab Tests Online site have vastly expanded and are localized for use in 17 countries and 14 languages. The expansion of access and availability of Lab Tests Online actively continues. In 2012, South Korea and Romania joined the global Lab Tests Online network, further demonstrating the extraordinary collaboration that occurs internationally. Additionally, Lab Tests Online launched a mobile version of the site in 2011 for Apple's iPhone, iPad, and iTouch, and Android phones and tablets to facilitate access needs. So with this invaluable resource at your fingertips, I highly encourage SYCL members to take advantage and fully explore this website. Expansion of each of the menu headings provides access to vast amounts of information pertinent to clinical laboratorians early in their careers and for veteran laboratorians too. You will find opportunities not only to learn a lot of information about laboratory medicine, there are additional opportunities to get involved through asking questions and receiving answers through Ask Us, providing comments and feedback to Lab Tests Online leadership that help facilitate future developments through Contact Us, as well as opportunities to contribute to the mission by spreading the word and raising awareness of this helpful and important resource.